First, disclosing solution is placed. Once anesthetic has been given, the Bioclear blaster is aimed at 90 degrees to the tooth surface. Planned gum lift is outlined with dotted line. In this case, the patient had a 3 mm pocket on the facial, which allowed us to do a 1.5 mm gum lift without resorting to more aggressive surgeries. Notice that the blaster is doing two things. First, it is preparing the tooth for adhesion. Second, it provides a predictable exfoliation of the soft tissue. Because Bioclear restorations typically wrap around most of the tooth, it is important to also remove biofilm on the palatal surface of the tooth. In most cases, the bleeding is mild. Here's a view before and after the gum lift. Gauze is placed on the palatal of the tooth to control the flow of astringent. Astringent is burnished into the facial and palatal gingiva to control bleeding. Care is taken during both placement and rinsing of the astringent to avoid having the patient taste it or go into their throat. Once the astringent is rinsed off, a small yellow BT matrix, used upside down, is tried in to evaluate the interface of the matrix to the tooth at a 45-degree angle. The matrix is bouncing out of the sulcus, therefore it needs to be trimmed. These are easy and intuitive trimming steps that will become second nature to the clinician in no time. It is crucial for the root overlay combined with the gum lift to achieve a 45-degree emergence profile. The color marking is helpful to show the depth of penetration of the matrix into the sulcus to reassure the clinician that the setup is ideal. Press the matrix for 5 seconds, similar to packing cord, to deepen and expand the gingival attachment. This assures a perfect margin without an overhang. Now the procedure can go quickly. Bioclear is always better and faster when the matrix choice and modifications are ideal. 37% phosphoric acid is placed and massaged for 10 seconds. Etchant is thoroughly rinsed around the area, then dried. Note that after trimming the BT matrix, it becomes stable in the sulcus. Scotch Bond Universal is massaged into dentin for 20 seconds. Enamel is simply wetted quickly with adhesive. Light cure for 10 seconds. Reapply adhesive as a surfactant, then inject heated flowable composite with the matching shade of the paste composite that will be used next. Slowly inject the flowable into the matrix tooth interface to achieve a 3 mm high shelf, then light cure for 10 seconds. Remove the trimmed BT matrix, which can be reused for more root overlays on this patient. Trimming. Use the coarse green flame burr dry parallel to the long axis of the tooth that will create a guide plane that the final matrix will rest against. Use a mirror to evaluate the volume and profile. Angle the coarse flame diamond burr to remove any composite past the line angles of the tooth. Margins on facial should be perfectly imperceptible and no marginal trimming should be required. The mylar finish here should ideally be maintained. This will allow a beautiful tissue response and stop the gingiva from creeping incisally later, a common problem with traditional gum lifts. Next, a smiley face is planned and excess flowable will be removed coronal to the shelf of flowable composite. Finally, a 12-blade in the Clark round handle scalpel instrument is used to remove inadvertent adhesive and flowable composite past the line angle. Once the contacts are sanded, we blast the entire complex, flowable composite and tooth, focusing on interproximal and lingual areas that may have inadvertent resin or other contaminants such as astringent. With the matrices in place, we are ready to injection mold. Note how the root overlay is holding the rubber dam apically in mid-facial. The root overlay also allows for added composite volume in cervical area for color masking and aggressive emergence profile to maintain the height of the gum lift.